implemented from the CBA up to date. That is, the government has totally ignored the CBA. And that CBA, if they implemented the CBA, even they would have neglected our enumerations, but they would have equipped the hospitals. The ventilators that we need today, if they if they implemented the CBA, we would have all the equipments that are needed. We would have a clean environment, a conducive environment, because maybe there could be no overcrowding in the hospitals, because it was in the CBA. They equip the hospitals, they provide a clean environment, they provide us with all the working equipment, they provide with our patients with all they needed. That means that the patients would not be sharing beds in the hospitals like today. Okay, we would have got the equipment, we would have the ICU that we could be now, we could be able to attend to our patients. If they implemented, we could not be fighting for allowances like now, because we would understand that even if the government doesn't have the money, they have given us some allowance that can push us until the government is stable. If they had put the human resource, there are so many nurses who are unemployed, but you leave a nurse or one nurse to nurse around 80 patients. You leave a nurse to tend to the clinic, child welfare clinic, to see over 200 children in a day. So, if they implemented, there would be less work today. We will not be complaining about burnout. We could not be complaining about overworking. If they employed more nurses, they could be able to attend to the patients on time. Even without the pandemic, there has never been enough workforce in the healthcare system. And if you've been following time and time again, you've seen doctors, nurses, clinic officers going on strike. And most of the time, when the healthcare workers go on strike, people always label them that they are going out because of money. And most of these times, people don't go out on strike because of money. There has never been enough healthcare workforce in this country. Even not half of it, because we still have a nurse who is to man a ward of around 60. On their own. And not just about nursing, it is about healthcare profession. All the healthcare professionals are understaffed. If you look at the recommendations by the Nursing Council, by the WHO, even if you look internationally on the nursing patient ratios, Kenya, we are far, far below that. So, I cannot really talk about the COVID-19 pandemic and the healthcare workforce. This has been a problem since time immemorial. Like, for example, if I am reporting on duty and I work in the maternity, that is the labor ward, and normally we'll report 2 nurses on duty. And we are supposed to handle all the women who come to deliver. And that is, for example, that is our night duty. So we are 2 nurses. And we are going to take care of like 10 women. If you're taking care of 10 women, you're taking care of 10 ladies and 10 babies. So who is going to handle the mother who comes for admission? Who is going to handle the mother who is giving birth? Who is going to handle the emergency? Who is going to do the referral? Who is going to document? So, as far as the workforce is concerned, that is one thing. And I believe that is why at the beginning of this pandemic, the Public Service Commission advertised that it was going to hire more healthcare workers because they now saw the need, but the need has always been there. Every day, and now it has become monotonous. They feel that we are the people who are supposed even to provide with the PPEs. They feel that we are the people who are supposed to provide medicine. They feel that the government has sent us a lot of money, is paying us a lot of money, so we are supposed to be enslaved. There is nothing that the community can understand. They don't know it is the government that has failed to provide. They feel that we are the people who are hiding them. Yes, how can I hide a mask and then put on one mask for 16 hours? How can I use a gown for 1 week instead of throwing away that gown immediately I finish up with one patient? Not once, not twice, not thrice, so many times. The nurses of this country, I would say, are always blamed for things that are beyond their control. And I'll do that giving examples. Most of the time, there is no medicine in hospital. And what do? Once the doctors prescribe the medicine, it is the nurse who is supposed to give the medicine to the patient. But now you go to the patient and you tell the patient that this is what the doctor has prescribed, but it is not there in the facility. So what will the patient do? The patient is going to blame you, start calling you names. Yet, you're not the prescriber, nor do you do the supplying. We have also seen cases whereby you're supposed to refer, like where I work now currently, we don't have an ambulance at the facility. So what do? If you have an emergency, you're going to make telephone calls just to ask for an ambulance. And while you're at it like that, the patient or the patient relative is there maybe abusing you and asking you why you don't have an ambulance, how comes you're disorganized, there is no ambulance. They even go ahead to blame you for the road. Where I work, the small road to the main road is bad. And even clients will come and they'll start complaining. Even when you tell them you're not able to assist them and you would like them to go to another facility, they'll even start asking you, sister, nitarundi aje? Hiyo barabara ni mbaya sana. So you see, it is beyond me to have a good road. It is beyond me to make sure there is an ambulance at my facility. It is beyond me to make sure that the medicine is at the facility. Even the supplies that we have, when we talk about the free maternity services, there are things that are not free. There are things that are not there for free. For example, you're supposed to tell this lady to go and clean the baby's cord. And you're telling her to clean the baby's cord like 3 times in a day. What is she going to use to clean that cord? Whatever she's going to use, if it is the antiseptic or it is the whatever solution she's going to use, if you don't have it in the facility, how are you going to provide it to her? If there were enough masks, if there were enough PPEs in general, I think there would be no transmission from health workers to the patient, because most of them, you see, like a clinical officer who has seen 100 patients per day. So in a week, those are 7 days. That's close to 700. Or maybe like in Ngara, where a clinical officer was seeing 160 patients per day. So you cannot cross-infect your patient or even colleagues. Why? Because sometimes you have to work even very closely. Maybe you are attending to a patient, that patient is restless. It is a nurse and a clinical officer. So the clinical officer may get it from the patient and transmit to the nurses. Or the nurses can get it from the patient and transmit to the clinical officer and the other health workers. So that social distancing, and especially in the facilities that we have, is not practical. Maybe outside Kenyans have tried. We've seen them wash
distance. We've seen them trying to keep distance. Even in the facilities, we are trying to do it, but we feel the government would have done more.
The government has given us a directive to put on a mask, but I keep on wondering, yes, we've put on the mask. How are we supposed to dispose the mask? So it is a noble idea, but the government could have gone ahead to give a more clearer guideline on the use of the mask, the kind of the mask, and the disposal of the mask. Secondly, when you talk about the curfew is an issue that needed to be discussed, and especially when you talk about the essential service providers, because we have seen cases whereby health workers have been abused, they have been beaten, yet they are the essential services providers. Just because you didn't get to work before the curfew begins, or maybe you're delivering something and you got late. Even if you show them the curfew, we've even gone ahead to print our curfew cards from our nursing council website. But by the time you even show the police officer that you have that curfew card that allows you to just bypass the curfew, he has already beaten you. I have not seen any trickle-down effects to us, except for the surgical masks. And I've always been wondering that there was 4.4 million that was spent on tea and snacks. Well, as at the facility level, we have never seen tea with our own eyes. We have to buy our tea. We have to know what we're going to take for snacks, and most of the time, even we have no time for that.
I think what we are receiving, even the retro PPEs we are receiving, as what was supposed to be in the facility from the one go. The things that we've been demanding for so many times when we are going on strike. So we don't feel it. We are hearing millions and millions has been spent. Even that cup of tea, you have never taken it. I think it is the government that is misleading the community and that is misleading the health workers. You tell them do not see a patient without the proper PPEs. There are those hotspot areas. Of course, do not go and see if there is a case in that area. I think you cannot see that patient without the proper PPEs. But I have not seen where the patient who has been turned up in our facilities, because that is where we are taking the risk. As we end up not sending a mother away, where will she go and deliver, even without the proper PPEs? And where they are turned away, I think it's the government that has given its own directive. If there is anywhere they have been turned away. But in our facilities, we are still seeing our patients because we feel for them. We are taking away that risk of even seeing them without the proper PPEs. And some of them are appreciative, some of them are not appreciative, because the far I can stretch myself is the much I can do. From what I know, Kenyans are sleeping in the house very sick. Because we were seeing so many patients, but now even they are in fear. Maybe even them, they are fearing to come to the hospital and contract the infection. We feel there are so many people who are in the houses when they are sick. They have no finances. They have no one to listen to them. They feel that maybe when they come to the facility, they'll be turned down. But even as we have our way of filtering emergencies.
The government and all the stakeholders, including the SRC, everybody who is involved, I would like them to realize the value of a nurse and stop grading nurses as semi-skilled. The nurses of this country have gone to school. Some of them have, most of the nurses you see around have done a degree. And when the Public Service Commission advertises for jobs and they are saying they are only going to employ diploma and certificate nurses, then what you wonder is, why is the government, why are the higher institutions of learning training nurses at the bachelor of degree level? Where are those degree nurses going to get their jobs?
I remember this health risk allowance was awarded by Moi in the year 1997, where he promised nurses during the system day strike that he will give them a risk allowance of 3,850. How do you feel as a government? You sit down, maybe those are human beings, the governments are human beings. You sit down in an office and you sit down and give one kanda 20,000, but you give another kanda 3,800. This is something that has been going on. This is the fight, that was the cause of the strike that has been going on, but you don't listen. You award one kanda, a CBA, but you deny another kanda, or the nurses, you deny them. Yet, these are the people you are entitled, you are entrusting the life of Kenyans. I'm sorry to say that a nurse is never supervised to give the drugs at the right time, to give the right drug to the patient. You are not supervised. Why does the government intimidate? Why do they discriminate us? Because we are not guided by anyone to do what we are supposed to do.
So for me, I would like to see a case whereby the SRC, the Public Service Commission, the government itself, and even the universities that are training nurses, let them come out clear and give a clear guidance to the Bachelor of Science in Nursing course. Nurses are well trained, nurses have gone to school, and you see again, when you come back to the government and the Public Service Commission, they are telling us that a doctor, a pharmacist, a dentist will get a job entry into the system at job group N because they have a degree. But we also have nurses who have degrees, and they did their degrees at the university together with these doctors. But what happens? These nurses are getting into the job market at job group K. Why? Yet, they also hand a A-. They hand their B+. They went to the University of Nairobi. They've gone to more university. They have studied with the doctors.